Good afternoon, everyone, and welcome to our weekly webinar for pay entry. Just a little housekeeping before we get started. Keep in mind, please, that these webinars are intended for educational purposes only, and while we do hope that you learn new information, the trainers that present our webinars are not attorneys. Therefore, all information provided during the presentation and the Q&A session should not be construed as legal advice. Additionally, for this presentation, all medical related information presented herein is provided by the CDC's official website. The presenters do not have medical degrees and are therefore not offering any form of medical advice. All right, well, with that out of the way, welcome to our presentation today. We are going to be talking about flu season, COVID-19, the Delta variant, and absenteeism, and how all of those affect each other because they are definitely intermingled. My name is Brianna Grimes, and I'm going to be your facilitator today. I am your Senior HR Services Advisor for Pay Entry, and I'm very excited to present on today's topic. If you guys have any questions throughout the presentation, please feel free to put them in the question box, and I will address them at the end of the presentation. All right, so just a brief overview of what we're going to be talking about today. We are going to talk about the flu versus COVID-19, kind of refresh our memories on the differences, the similarities, and any updates the CDC has made to their website since last year. We're going to talk about the Delta difference in the Delta variant, so we can kind of see what the CDC has outlined with regards to the new strain that is out there. We're going to talk about allergy season and how that fits in, because typically September, October is one of the peak allergy seasons outside of spring. So we're going to talk about how allergies differ from the flu and COVID-19 symptoms that are out there. We'll talk about how to protect yourself and your employees, and then we'll also give you some tips and things to think about in terms of handling excessive absenteeism and what's the best way to maneuver those types of situations without taking on a bunch of liability. And then, of course, at the end, I will address any questions that come up. All right, so let's start by talking about the flu versus COVID-19. So ever since March of last year, we have been bombarded with information regarding COVID-19. I mean, everywhere you look, the CDC website, the news, all of it is just pertaining to COVID. However, a lot of the information that we've seen already has primarily dealt with answering questions like, what was COVID? How is this going to affect my business with the shutdown? How do I protect my employees? What sanitizer should I use? How long does COVID stay on surfaces? Now we are looking at questions like, how do we bring people back to the office? Should vaccinated people wear masks? Should we mandate a vaccine? There are different questions coming about pertaining to COVID as this pandemic moves forward. So we never anticipated that this was going to last as long as it did. But because it is lasting as long as it did, and now that we've got a new variant, we've got some new questions that we need to address. So one of the questions is, how do we deal with COVID specifically in the fall? Because like I said, you have allergy season, we've got flu season coming up, we've got COVID regular and COVID Delta. So we've got a lot of different things kind of intermingling, and a lot of companies are bringing employees back into the office full time because the vaccine was made available summer or spring of this year. So the questions that we're dealing with now are a little bit different. So first, we're going to take a look at some of the similarities between the flu and COVID-19, as well as some of the differences. So we can kind of see how the two compare and what employers need to look for. So the key similarities that you should keep in mind are that both COVID-19 and the flu are contagious respiratory illnesses, and they're both caused by viruses. They are different viruses, but they are viral nonetheless. And because of these similarities, they also share a lot of the same symptoms, as well as having varying degrees of these symptoms, ranging from asymptomatic, meaning that they do not show any symptoms, to severe in need of hospitalization. And we'll talk more about symptoms in a little bit. They also now both have a vaccine available. Now, as far as the key differences go, COVID spreads more easily than the flu. COVID is also considered more serious for some people than the flu. COVID takes longer for people to show symptoms once they have been exposed to COVID, and people infected with COVID are contagious for a lot longer than the typical flu. So those are really the key similarities and differences between the two as defined by the CDC's website. Now we're going to talk about symptoms of these viruses so you can kind of know what to look for as we head into the fall and flu seasons. So first, we're going to take a look at the shared symptoms between COVID-19 and the flu. So they are fever or feeling feverish or chills, cough, shortness of breath or difficulty breathing, fatigue and tiredness, sore throat, runny or stuffy nose, muscle pain or body aches, headaches, vomiting and diarrhea, and this is more common in children than it is adults, that last symptom. So these are the symptoms that the flu and COVID typically share. So if someone has come into contact with someone who has the flu, they probably are going to show some of these symptoms, and vice versa with COVID-19. Now, their symptoms are so similar that the two infections are almost indistinguishable without the test to confirm, which is why COVID testing is very, very important to anybody who has been exposed. You can still get COVID tests at the CVS pharmacies. They have the drive-through, they have the 2-day, they have the quick turnaround tests, and now they even have over-the-counter at-home tests. So there's a lot of testing available to be safe and be certain that you do or do not have COVID. All right, so really the only difference between these two infections are that the flu tends to have more mild to severe symptoms, and their symptoms usually develop within 1 to 4 days after being infected. So there's a very short window for the flu to kind of rear its head in a person's body. So if an employee has a family member that has tested negative for COVID-19, but they had the flu, it's very possible that the employee may show flu symptoms in the next few days because they were exposed to someone with the flu. In addition, a person with the flu is primarily contagious for up to 7 days after their illness has subsided. This is a very typical number that we know of every strain of the flu that has ever come out. This is what the CDC outlines on their website, that really the flu kind of caps out at that 7-day period. Now, on the other hand, COVID-19 can be, like I said, asymptomatic, meaning it has no symptoms, or it can be very, very serious with serious illnesses with the added symptoms of the two that we're familiar with by now, the change or loss of taste and smell. Now, COVID-19 symptoms can arise anywhere from 2 to 14 days after infection. So there's a lot bigger window for COVID-19 than the flu. Also, the CDC says that people remain contagious for about 10 days minimum after symptoms appear or after they have tested positive. It can also be 20 plus days if they were hospitalized with severe symptoms or they have weakened immune systems. So a lot bigger window for those who have more severe reactions to COVID, as well as those who have weakened immune systems. Now, the CDC on their website has not said anything specifically about the side effects for the vaccine in terms of if they have a severe reaction to the vaccine, what that period of time is that they could potentially transmit the virus, because it is technically in their body with the symptoms that they have. So they haven't really given us a window for that. But under ARPA, employees are eligible to take time off if you have opted into ARPA for time to get the vaccine as well as recover from any symptoms. So now let's talk about something we didn't have to talk about last year. Let's talk about the Delta variant, because that is really what's kind of been on the top of everybody's mind lately. So the Delta variant has become a new concern regarding COVID-19 cases, especially this year around midsummer time. So according to the CDC website, as of August 24th, so 2 days ago, the Delta variant is considered more infectious, thus leading to the increase in transmissibility that we are seeing. In fact, it is 2 times more contagious than the original strain, whether the person is vaccinated or not. The Delta variant is currently the predominant strain in the United States, and data does suggest that it may cause more severe illness in unvaccinated persons than vaccinated persons. Additionally, vaccinated persons can still get and transmit the Delta variant, which is why the CDC has updated their website to encourage the ongoing use of masks for everyone, regardless of vaccine status, in order to slow the spread of this new variant and give everybody the opportunity for the vaccine to help fight it off. Other than these main differences, the Delta variant is the same as the original strain of COVID-19 from last year in every other way. These are the only main differences that are outlined as of right now on the CDC website. Other differences are still being researched and investigated, but unfortunately, there is not conclusive enough evidence for the CDC to include anything else on their website. I know there is a lot of stuff out there right now on social media, Facebook, Instagram, grandma who's got too much time and is all over the news researching this stuff. So whenever you have any questions or you hear anything, take it with a grain of salt. Go back to the CDC website because that is going to be probably the best source of information during this time as they are investigating this new variant and how it affects businesses as well as individuals. All right, so on top of flu season that is now complicated by COVID-19 and the Delta variant, we also have allergy season. Now, allergy season can really depend on where you live, but it usually occurs at springtime and then late summer into early fall. So typically we start seeing allergy season right at the end of August, beginning of September, going all the way through to October, depending on where you live. Most people who have seasonal allergies know that they have them and they know when they're going to occur. For example, my allergy season since I moved to Texas is March through May because that's when they do all of the farming. There is everything in the air. And then September through mid-October. So right in the middle of September through the middle of October, I don't know what's in the air, but I turn into a sneezing, teary mess. But that is definitely my allergy season. It is consistent every single year. And most people that have allergies know it. They know it's coming. They know the sneezes, the itchy, watery eyes, and the runny nose is going to be there for a while. So during allergy season, people will show very similar respiratory symptoms to COVID, such as things like coughing, fatigue, headache, sore throats, congestion, or runny nose. A lot of those symptoms cross over between COVID and allergy season, depending on the type of allergies that people have. They may also have the shortness of breath or difficulty breathing, especially if they have an underlying condition such as asthma that is also compounded with their allergies. However, allergies tend to have the added symptoms of itchy or watery eyes and sneezing, which is not typical of COVID-19. And again, most employees who have seasonal allergies know that they have them. So if you see someone in the office or you have someone in the office or even a customer come in and they're sneezing like crazy, obviously we still want them to cover their mouth and, use hand sanitizer, wipe down anything they touched because they may be asymptomatic and they could still spread COVID if they have it. But that's not necessarily a symptom of COVID. It could be seasonal allergies. It could be allergies, that maybe they came from a friend's house that had a cat or something that, they're allergic to. So don't freak out too much if anybody starts sneezing like crazy as we enter allergy season. Just make sure that obviously we don't want them to spread anything that they may have. So we still want to focus on hand sanitizing and disinfecting anything they touched after they sneezed. I always warn everybody when I am in allergy season, so they don't freak out when I sneeze and cough. I know when I go to the grocery store and I sneeze during allergy season, I feel like a pariah because people look at me weird. But for the most part, my employer, my employees, people that I'm around when I'm hanging out and, socializing, I always let them know, hey, it's allergy season. I'm going to sneeze a lot. I'm going to tear up. I'm not sick. This is normal. But you can never be too cautious, especially in the day and age that we're in right now, and rather just assume it's allergies, or if someone doesn't have regular allergies, a COVID-19 test can always be taken to confirm that that's not the case. So if any of your employees, are sneezing and coughing and, they feel weird and, they might think it's allergies or maybe they've never had allergies before, a COVID-19 test is really going to be the best source of information to make sure that they don't have it. So it seems like there's going to be a lot of coughing, sneezing, sniffling, and things like that going on from now until next summer, because as we all know, as the weather gets colder, all of these viruses come out to play. So what can you do to help protect yourself and your employees going into the second fall and winter season that we've had to deal with this pandemic? Obviously, we want to continue social distancing as much as possible at work, and we also want to encourage quarantining for any employees that are sick or have been exposed or have recently traveled to any hotspots. If you're not doing so already, I would encourage doing some type of a weekly or monthly hygiene education lesson during your company or team meetings. Just something where the managers talk about the importance of washing your hands, sanitizing, things like that. I would recommend stocking up on hand sanitizer if you run low. We've seen, before last year in the winter time, a lot of companies ran out of hand sanitizer. We couldn't find them at Target or Walmart. We don't know if that's going to happen again, but you always want to be cautious. So I would stock up on those types of supplies so you have them readily available in your office for your employees. Also, just educating employees and encouraging them to use the different techniques and tools and sanitization that is available is really going to be the key to keeping everybody safe. Also, if you brought your employees back to work permanently, make sure that you or your facilities team is keeping soap in the restrooms well stocked, that you have plenty of hand sanitizer, again, encouraging hand washing. One company even decided to go with like a caught sanitized game. So if a manager saw you sanitizing your hands at your workstation or a common area, or they were wiping off the tables with a Clorox wipe, they would get like a $5 Starbucks gift card or a $5 gas gift card. And it really just kind of encouraged everybody to be on the lookout and to keep each other safe. It's a great way to engage your employees, make it a fun game, but also making sure that, they're taking extra time to be hygienic. Now, the most difficult part of the COVID-19 crisis is the fact that it feels like almost every state and city is handling this pandemic differently. And I know that's been a lot of frustrations for a lot of our clients. States like California are still in lockdown in some parts of it for industries and different locations. Places like Florida are pretty much open for business. Some cities require masks. Other cities just don't care to enforce it. So be sure to keep up to date with your local city and state ordinances, as well as utilizing whatever your stance is on vaccinations. You are able to mandate vaccines. In some areas, some states and some cities have actually said that that's not legal. So you really need to stay up to date with those state and local guidelines to make sure that you are following them, not only with regards to the mask mandates, but also any vaccination mandates. As open enrollment approaches for some of you who do their open enrollment in the fall, you may want to talk to your benefits broker about adding teledoc services to your medical plan. This has become insanely popular over the past year, and a lot of employees are loving the option to talk to a doctor digitally, paying only a $10 or $20 copay, depending on the benefits package, and then getting their prescriptions sent to their pharmacy without ever having to leave their home. All they have to do is go to the drive-through, pick up the pharmacy, and they're good. So it has really decreased the amount of contact that employees do have to make with outside people if they are sick or if they do need a prescription. This also helps keep them safe from, even if they don't have COVID and they have to go for a regular checkup, or maybe they do need to go get their allergy prescription taken, so they need to get their allergy test annually. It helps to make sure that they don't accidentally get exposed to COVID by going into the doctor's office, especially as we're seeing in many areas. A lot of hospitals are running out of resources, they're running out of rooms. A lot of people are opting to go to their primary care physician or to non-emergency medical buildings, and so that may make it a bigger issue with contracting COVID because you may have a COVID patient sitting in the doctor's office for the same person that's going for their annual physical or just their regular seasonal allergy test. So definitely having those online services can be a huge benefit to keeping your employees safe. And the last technique we recommend is to find some way to incentivize safety. Most employees don't want to go home. They don't want to get tested. They don't want to quarantine. They want to work. They don't have to worry about their paycheck. So staying at work and infecting the rest of the employees doesn't do any good if they're constantly afraid of getting COVID or missing out on their paycheck because they have it. So if your company has opted into ARPA, remember that it does end at the end of September. If you have not opted into it, just having some type of kind of safety net for employees if they are legitimately sick, if they do have COVID, to make sure that they don't come to work because they feel like they have to get their paycheck. So incentivize them to stay home if they have COVID, allow some paid time off specifically for COVID, or getting the vaccine or symptoms of the vaccine can be hugely helpful, especially as we head into the winter seasons. Another question that usually follows when employees are sick is how do we handle absenteeism, especially when it's excessive? So there are a few key things to keep in mind before you move to any type of disciplinary actions. First, has your company been opting into the ARPA paid sick leave? It was an optional benefit, but if you used it for employees at any time, you must continue offering it until it expires on September 30th, 2021. This leave time is protected and you cannot discipline employees for using it, so it does not count as absenteeism. Also remember that this includes time to get the vaccine and recover from any side effects. Next, you have a state mandated sick leave. States like New York, Arizona, and California, just to name a few, all have state mandated sick leave programs. So if an employee is using their sick time under these programs, you cannot discipline them for taking the time. This includes PTO plans. So if you offer a more than generous PTO plan and you don't technically by law have to separate out sick time, you still can't discipline employees for using sick days up to the state required max per year. So even if it's classified as PTO, but you know the employee is taking time off because they're sick or they're getting their vaccine, or they have COVID or anything like that, you can't discipline them for that time if your state has a mandated sick time policy. Also, think about how you have handled other situations with other employees this past year. Consistency is really key when you're doing any type of disciplinary action or putting anybody on any type of corrective action for absenteeism. You have to be clear and outline what is considered excessive absenteeism. And remember that this expectation must be reasonable. If your policy states that employees cannot have more than 3 days of absenteeism per year, that's not really a reasonable expectation given our current situation, and it could get you into trouble. So you want to take a look at your policies going into this fall season and make adjustments or exceptions as needed. Also, regardless, just make sure you're consistent across the board so you don't take on any unnecessary legal liability. Being flexible during this time and making sure that you're keeping your employees safe is going to be a lot more important than terminating people because they're absent too much, especially in the market we're in right now when talent is really hard to find. And finally, you want to ask yourself, do you really want sick people at work? The whole purpose behind sick time when they passed FFCRA and ARPA and all that stuff was really to provide leave options to ensure that sick workers don't come to work and get other people sick. Now, with the Delta variant, keeping sick employees at home is more important than ever to stop the spread because it affects both the vaccinated and the unvaccinated person. So understand that during the winter months, your company may have to have some leniency regarding sick time. Maybe you bring back the option of working from home for some people who can, if they are sick or if they need to quarantine. But ultimately, the question really becomes is, are you willing to risk it for the sake of a policy? So be willing to be flexible on your policies, be willing to take everything on a case-by-case scenario. And for those of you who are HR service clients of ours, if you ever have any questions or you need to walk through a situation, you can always call Kathy or myself, and we'd be more than happy to help you and give you some guidance. All right, so that is really all I have for you. I know that was a lot of information, and hopefully some of it was kind of a review going into our second fall winter season in the COVID pandemic. But remember that if you are one of Payentry's payroll clients, you do have access to Kathy and I for some basic questions. So if you do have any basic questions or anything like that, you can always reach out to us. Also, this presentation was recorded, so if you want to see the recording, you can always visit our website at www.payentry.com and go to the recordings under the webinars tab, and you can see all of our webinars we've ever done. We keep them all up there so you can revisit them as resources. Also, the handout is on the GoToWebinar portal, so if you click on handouts, the handout for the slides should be here, be there as well, so you can take a look at them. All right, so let me see if we have any questions. All right, was ARPA extended until the end of the year? Not to the best of my knowledge. I know some states have ARPA that is similar or a form of ARPA, so it may have been a state extension that you may be thinking of. I will look that up and just make sure, and then I will get back to you on that. But I think you're in California, so it may have been a California thing. But as far as I know, when I checked, ARPA had not been extended. It is still ending as of September 30th. And it is optional. Other question, can we require employees show proof of negative, positive COVID test? So it depends on the circumstance. If that employee is traveling and you would like them to take a negative COVID test before coming back to work, you can absolutely do that. COVID tests are free, so you can mandate it. As of right now, it's really kind of up to you as the employer, as long as you're not violating any of the employee's rights. But requiring a proof of negative COVID test is not an issue. If they're traveling or if they became exposed to COVID, if they're just sick, and they want to stay home and they go to the doctors and the doctor clears them to come back to work, a doctor is not going to clear an employee to come back to work if they have COVID. So just requiring a doctor's note as regular should be fine. If they didn't go see a doctor and they may have been exposed to COVID, you can absolutely substitute and ask them to get a COVID test. Have the employee retention tax credits been extended? I'm not entirely sure on that one. I know that's kind of Kathy's area of expertise. I will check with her and I will get back to you. I don't think they have, but don't quote me on that. So I will take a look at that one as well and double check. All right. Well, thank you all for attending today. Next week, Kathy is going to be talking about managing a partially vaccinated workforce. So she's going to be talking about more things pertaining to vaccinations, how to keep track of them, should you mandate the vaccine, how to continue the mask mandates and things like that. So if you have any specific vaccine questions, definitely bring them next week because Kathy is going to have a great presentation available to you guys. If you have any suggestions for future topics you guys want to hear as we go into Q4, please feel free to include them on the survey at the end of this presentation. And we would love to hear if you guys have any suggestions on things you'd like us to talk about. But if there's no other questions, you guys have a great rest of your week and we will see you next week.